A Humerus review. Kinesiologykris.com. Hello and welcome to Kinesiologykris. My name is Kris, and today we're going to be having a humorous conversation. Now let's go ahead and begin. First thing I want to do is start with a blank canvas. So we're going to go ahead and just leave the outline of the humerus so that we can build it piece by piece as we go along. Now I'm just going over the bony landmarks of the humerus, and the origins and insertions will happen in another video. So to begin, we're going to start from the top and work our way down to the bottom. Alright, so let's get this party started. What's a party without a game? Let's go ahead and play Simon Says. Simon Says, knock on your head. Alright, good job. Now if you knocked on the head that has a brain in it, bad job. The actual head you should have been knocking on is right there in the shoulder joint, and it makes up half of the ball and socket joint. Of course, seeing that it's round, you could probably guess that it's the ball portion. Now we know every head needs a neck. This humerus bone actually has two necks, has an anatomical neck and a surgical neck, located here and here. The surgical neck is a common site for fractures, which is also a common site for surgeries. Now moving right along, we go to the greater tubercle, located here. What makes this tubercle so great? Well, there's also a lesser tubercle, located here. The greater tubercle is bigger, stronger, pays its bills on time, so forth and so on. Lesser tubercle, well, it does less. But even though it does less, the greater tubercle still respects it. In fact, they get down and groovy all the time, so much so that there's a bicipital groove located right between them. So let's head down this road here a little bit, right to the middle, and we'll find all by itself and lonely is the Deltoid Tuberosity, hanging by itself, located right here. And even though that sounds sad and depressing, it's not, because the lateral and medial supracondylar ridges are located right below it. And seeing how they begin to fan out, they'll catch him if he falls. The lateral supracondylar ridge is located here, and the medial supracondylar ridge is located here. And just below the ridge, we'll find the medial and the lateral epicondyle. Medial located here, and the lateral located here. Now moving along, between the lateral and the medial epicondyle, we got a fossa. A fossa is kind of like a shallow cave. Gives things a little bit of room to wiggle. So in this case, when I'm at the gym flexing my usual 75-pound dumbbells, the head of the radius needs some room to move. The radial fossa provides that room. Now the radial fossa has a partner in crime. Its name is the Coronoid Fossa, and it has the exact same job. It's just to make a little bit of room for the arm when it bends. This receives the coronoid process of the ulna, making room for it when the arm flexes. So moving just below the radial fossa, we'll find the capitulum, which is main job is to articulate with a small depression in the head of the radius as the arm flexes. Now a good memorization technique I like to use is capitulum to me kind of looks like capital, and capitals have a large radius. That way I always know that the capitulum articulates with the radius. Alright, so doing the same thing, but on the medial aspect, underneath the coronoid fossa, we have the trochlea. The trochlea articulates with the trochlea notch of the ulna. Alright, so on the posterior aspect of the humerus, we have the Olecranon Fossa. Basically, this receives the summit of the olecranon on the forearm, which is basically the pointy part of your elbow. So when you go to extend your arm, your elbow doesn't remain pointy and it kind of straightens out into a flat surface. Alright, and then the last thing we got is the Radial Sulcus, which is located here. It's also known as the spiral groove or radial groove, whatever you want to call it. Next video is about the origins and insertions of the humerus.